This is Dr. Paul Thomlinson from Compass Health Network, and we're doing a continuing series of podcasts aimed at inspiring hope and promoting wellness. Here, we're aiming to create an evidence-informed understanding of many of the problems and issues we face in these challenging times we're living in and living through. I'm doing at least one episode each month tied to our calendar of observances for the year. And this is the March episode focusing on Women's History Month, during which we honor the generations of trailblazing women who have built our nation, shaped our progress, and strengthened our character as a people. Of course, at Compass, we're particularly interested in promoting wellness, and as a psychologist, I am particularly interested and fascinated by the subject. And having taught history of psychology courses for many years, I can tell you for sure that the enormous historical contributions of women to the advancement of mental health and the unique mental health needs of women in general have often not gotten enough attention. So that's one reason I'm really happy to have this opportunity. What we aim to do here in celebration of Women's History Month is highlight a few of the major historical contributions of women to psychology and mental health, and then offer some suggestions for how we might better take care of women's mental health, including the women in our lives. And I recognize that as a dude, I'm woefully deficient in estrogen to do all that by myself, so I have as my guest the wonderful Dr. Robynne Lute, who will provide most of the meat for this episode, and give it more, shall we say, authenticity and legitimacy. We don't need me mansplaining the entire episode about women's history, so I'm grateful Robynne agreed to contribute to this episode during a very hectic time for her. But first, a few thoughts from an old professor who has taught a bunch of history of psychology courses over the years. Although I had a lot to choose from, I narrowed down my list of women heroes of mental health and psychology to 3 I've particularly admired and been inspired by the most. And they're all very different for sure. One commonality you'll notice about these 3 women, though, is that they were all clearly influenced by, or even driven by, their own lived experiences to make things better for others. Now call it what you will, but to me it seems they all manifest a kind of fierce, nurturing, and healing energy that is characteristic of the feminine. Now, it seems that way to me. I don't necessarily have any hard data to support that contention. Anyway, my first mental health hero for Women's History Month is Dorothea Dix, a nurse who was instrumental in founding or expanding more than 30 hospitals for the treatment of people with mental illness during the latter half of the 1800s. And during that time, conditions were simply unimaginable to most modern minds for those with mental health problems. Now, she was motivated by her own lived experience of mental instability to become a leading figure in national and international movements that challenged the idea that people with mental illnesses could not be cured or helped. Her tireless work promoted the inherent value of compassionate care for those who are vulnerable and suffering. And she was a fierce critic of cruel, neglectful practices such as caging, incarceration without clothing, and the painful physical restraints of the time. Now, it's hard to overstate the impact she had in improving the living conditions and treatment of folks with mental illness. And her legacy is still evident every single day in the way we provide care in our inpatient psychiatric units, with a focus on safety, dignity, self-determination, and compassion. So, cheers to Dorothea Dix. Now, my next 2 choices for psychological heroes happen to be the exact same ones chosen by my guest, Dr. Robynne Lute, independent of any consultation with me. So, I think it's best to let her do the talking about the other 2 trailblazing women, to whom we clearly owe an incalculable debt, as you will hear. So here's Dr. Robynne Lute, a woman of great wisdom, compassion, and heart, answering my question: who are your women psychological heroes, or which women psychologists have been most influential in your own life and career?
When I think about early influences for my own career, my own education, one woman in particular really grabs my attention as somebody who showed me that not only can women achieve amazing things within the field, but also that those accomplishments have very real-world implications. Her name is Mamie Phipps Clark. Dr. Clark was born in Hot Springs, Arkansas in 1917, and she was the first African American female to earn a doctoral degree in psychology from Columbia University, which in and of itself is a laudable achievement. Dr. Clark is noted for her work on self-esteem, child development, racial identity, self-identification in children, as well as having an impact in the civil rights movement. She began her studying looking at the impact of segregation on Black children, and was later joined by her husband in her work, and they developed a very classic study known as the Clark doll test. This experiment was so elegantly designed and really provided us with just mind-boggling information about the impact of bias and racism on children and their self-esteem. The Clark doll test showed that Black children were in fact impacted by segregation, which at the time of the study, many people purported the notion that segregation was a separate but equal type of arrangement, where it wasn't hurting either whites or Blacks in this case to be separate from each other, that they had equal experiences in terms of their development, their education, their self-esteem, their experiences in the world. With the Clark doll test, Dr. Clark showed African American children two dolls that were identical in characteristics and features other than the color of their skin, so to speak. So one doll was Black and one doll was white, and they were otherwise identical. So she asked young Black children to speak about the dolls and to answer some questions about them, including things like, show me which doll is the good doll and which doll is the bad doll, which doll is the nice doll, which doll is the mean doll. It may not seem that surprising in 2022 to hear of the results, yet at the time the results of this study were really revolutionary and very groundbreaking, to see that African American children would identify the Black doll as being the bad doll. They would ascribe negative characteristics to the Black doll over the white doll. And in fact, what is just fascinating is when these children were asked to choose which doll most resembled them, or which doll did they look like, up to 33% of Black children chose the white doll, which was really instrumental in demonstrating the impact of segregation on children's development and self-esteem. So whereas many individuals had previously ascribed to a notion of separate but equal, that segregation did not have an impact on children's development and self-esteem. Her study not only showed otherwise, but it contributed to very real-world consequences, wherein this research was used to look at the law upholding segregation, and she testified in the seminal case of Brown versus the Board of Education in 1954 that actually went to the Supreme Court and was instrumental in overturning segregation.
Forgive me for this footnote, but the timing is just exquisite here during Women's History Month and having just come through Black History Month. I can't help but think about the fact that Judge Ketanji Brown Jackson, a product of integrated Florida public schools herself, has just been sitting through Senate confirmation hearings in consideration of becoming the first Black woman Supreme Court Justice in history. I'm sure Dr. Mamie Clark is smiling somewhere and leading a cheer for Judge Jackson. Now on to the second woman hero of psychology that Dr. Lute talked about.
Another woman in psychology who is one of my heroes is a little bit of a more contemporary individual, and she is named Margaret Linehan. So Dr. Linehan was born in 1943. She is another American psychologist. She is not a social psychologist like Dr. Clark, however. She's a clinical psychologist like I am. Dr. Linehan was instrumental in creating a type of therapy known as DBT, or dialectical behavior therapy. The importance of DBT for the mental health world, specifically for the individuals suffering with these types of severe emotional dysregulation that DBT targets and treats, simply cannot be underscored. Some of the most common disorders that we know or think of when it comes to this type of emotion dysregulation include borderline personality disorder, suicidality and suicidal behaviors, which Dr. Thomlinson, you and I both have a personal interest and clinical investment in, as well as substance use and drug addiction. Historically, each of the disorders or struggles that I just mentioned have been very difficult to treat effectively in a reasonable, reliable, cost-effective fashion. And so the creation of DBT, which is in short verse maybe a blend of Eastern and Western psychology, if you will, or more specifically, combination of cognitive behavioral therapy and Buddhist techniques or philosophies such as mindfulness, has been the only treatment that has shown to be effective in reducing suicidal behavior in a cost-effective setting and cost-effective fashion. It's a gold standard treatment for borderline personality disorder, which again has been a very difficult to treat, complex mental health disorder over time. In terms of her career, of course, being such an innovator with this life-saving treatment for so many people, has, meant she's received many awards and accolades, rightly so, for her work, and she's written many books and publications on her treatment and her approach, as well as a memoir about her own experiences. One of the things I did not know when I initially studied and learned about DBT was that Dr. Linehan herself was actually diagnosed at a very young age with schizophrenia, and she was placed in an institution. And after she left the institution at the age of 18, she no longer took any psychiatric medication as far as her own recollection, and has come forth in later years to say that that was a misdiagnosis and that she herself lives with borderline personality disorder. And I admire that forthcomingness, that willingness to use her own platform as a way to destigmatize mental health, as well as to show that, holy goodness, someone with some really challenging beginnings and symptoms and struggles has gone on to not only have a successful career, but to actually create something that has changed the lives of people all over the world with very severe and significant concerns, and has directly saved lives with her willingness to share her experiences and to create and form those experiences into a type of treatment that is actually effective for things that we as psychologists used to really struggle with and really find difficult to be helpful despite our best efforts.
Well, hopefully these examples of women who have lived and made mental health history have inspired hope, which is the first part of our mission statement at Compass. But how about that second part, promoting wellness? Well, on that note, to close this episode, I asked Dr. Lute to share a few strategies or tips for taking care of the women in our lives and for women to better take care of themselves in the midst of these challenging times we're living through. To that, she said this.
I would say first and foremost that women struggle with self-care, and self-care is something that we all need. There's a tendency, and of course this is a generalization, and yet it holds true, that women are caretakers. We tend to take care of our parents, our siblings, our children, our partners, our pets, and have a tendency to somehow continue to place ourselves lower and lower on that totem pole of who needs attention and who needs care. And some women go so far as to feel that self-care, focusing on their own needs, really taking time to tune into, what makes me feel good, what keeps me healthy, is somehow selfish. So that these two words have become synonymous, that self-care is selfish. And that is absolutely not the case. They are two different words for a reason. They mean two different things. Self-care is, again, simply taking some time to reflect on what we as women need, and it's going to look different from person to person, to feel healthy, to feel fulfilled. So for some, this is going to maybe be needing to take a nap from time to time, or focusing more on carving out small moments of meditation, deep breathing. For others, this may be engaging in a hobby that is creative and fun and reliable in terms of producing a sense of pleasure or accomplishment. And so focusing on really decreasing the guilt that can come with saying no, with setting boundaries, with saying, I have needs and I can't do everything for everyone all the time. There's a popular aphorism that, we speak of in mental health, which is, if you've ever flown on an airplane, of course, you hear, put your own oxygen mask on before you help others. And I think women have a tendency to run around the plane wanting to put on everybody else's oxygen mask. And if that happens, guess what? We run out of oxygen and we're no longer able to help other people. If we're falling out, we can't do anything for others. So it's important to make sure that we have that baseline of self-care and self-love and attention that is not filled with guilt or shame or diminishment of our own importance. I think a second big and accessible tip that I would give for maintaining wellness and mental health would be to move your body. So it does not have to be that we run marathons every weekend, or we can, bench press 250 pounds. I'm talking about just getting up from your chair, getting up from your bed, going outside, going for a walk. Nature in and of itself tends to have a beneficial effect for individuals' mental health. And we have become a sedentary population over time, which means that we tend to sit a lot. And so women need to move. They need to get up. They need to dance. They need to take the stairs when they can. They need to find small ways to incorporate movement into their lives. So this could be as simple as parking one's car further away from a store. So for those of us that feel very pressed for time and feel like we can't carve out time to go to the gym, just taking these small changes and taking the stairs, adding little walks, taking a break at lunch, getting up, stretching, moving, especially if you can combine this with going outside, getting some sunshine, just having the calming effects of nature can be a very, very beneficial impact on mental health, well-being, a sense of calm. I think we can't, again, underscore enough the importance of social support. So for women, for all people really, but since this is our focus today, it's important to have other individuals around you who genuinely support you, care for you, and want to see the best for you and are able to be there for you, to listen to you, to encourage you, to comfort you. And there's a quote or a saying that I don't know to whom it's attributed. I can't find that, but I once heard it, and it just really stands out to me. And it goes like this. It says, "Surround yourself with women who would mention your name in a room full of opportunities." And I think that is such an amazing statement. So there's an element certainly of not focusing on quantity of friendships, but quality of friendships, to find people in your world who are rooting for you, who are wanting to see you do well, who want to see you succeed and be there for you. Do you think this is one of the areas that has been really impacted by the COVID pandemic in terms of individuals not being able to access incidental social contacts at work or in person that can have little mood boosting effects for all of us, and in a bigger sense, literally not being able to connect with family and friends who are those champions, who are those people who are on our side and who are rooting for us, has caused an increase in depression and anxiety, as well as substance use, interpersonal violence, etc., for so many people. So it's wonderful that we're seeing some decrease overall in the cases and the restrictions, and hoping to see everyone able to reunite, return to somewhat of a normal, quote unquote, social life, and to be able to get those hugs and those comments and those encouragements that are so needed for all of us to stay well and to get better and better.
Better and better. A phrase familiar to Compass folks, and a great note for Dr. Lute to end on. To briefly summarize what I heard her say, in order to continue to get better and better, remember, self-care is not selfish. Move your body on the regular. Sitting is the new smoking, as they say. And seek, find, and nurture those precious and nourishing social connections. That quote she shared is worth repeating, so I will. Surround yourself with women who would mention your name in a room full of opportunities. Thanks for listening, and happy Women's History Month.